Your thyroid gland is a little butterfly-shaped gland. It sits here. I'm going to point it on if you're watching a video of this, it's right here at the bottom part of your neck on either side of your windpipe. And then it has a little bridge that goes across. So it looks like an H, like the Honda sign. And it's part of your endocrine system. And endocrine means that your body creates and secretes chemicals that stay in your bloodstream and go to other parts of your body and cause actions to happen. They cause energy, or they cause proteins to be made, or they cause your muscles to contract faster, or your heart to beat faster, and those are just a few of the things that thyroid does, because it really does affect your entire body.
Hello, everyone, and welcome back to another episode of Wellness for Life. I'm your host, Niki Wolf, and today we are going to be exploring thyroid health. So, thyroid health can feel like a mystery for so many of us. You've likely heard of terms like TSH, T3, T4, and antibodies thrown around, but what do they actually mean? And how can you use this information to take charge of your health? Today, we are joined by Dr. Dana Gibbs, an expert in thyroid health and hormonal imbalance, to help us decode thyroid blood markers and understand how they impact our overall health. By the end of this episode, you'll feel so much more confident interpreting your thyroid labs, recognizing potential issues, and knowing what questions you should be asking your doctor. If you're ready to demystify thyroid health, this is going to be the episode for you. Again, our guest today is Dr. Dana Gibbs, a board-certified ear, nose, and throat specialist. She's also an integrative thyroid specialist. She's the founder of Consultants in Metabolism, where she helps patients with conditions like Hashimoto's, Graves' disease, and thyroid-related metabolic disorders. Dr. Gibbs blends conventional medicine with integrative therapies to provide root cause solutions. Welcome to the show, Dr. Gibbs.
Hi, thank you so much for having me.
Absolutely. I'm really excited for this conversation. I feel like I'm one of those that is still a little bit in the dark when it comes to thyroid health and understanding the markers. And I understand how powerful it is to know all these markers and how to optimize them. So I'm excited to kind of lay out the foundation today and learn a bit more about thyroid health. But before we begin, do you mind sharing what drew you to specialize in thyroid health, and how does your approach maybe differ from conventional care?
What drew me was that I went for years and years with a thyroid disorder that was undiagnosed. I did not have abnormal TSH, and we'll get more into that, what that means later. But I had a lot of the symptoms, but I wasn't overweight. None of my doctors through my high school years or college or medical school or even residency even thought it didn't even occur to them that I could have a thyroid problem. And so I went for years, exhausted, cold, having trouble with sleep, dry skin, thin hair, lots and lots of different low thyroid symptoms. And I didn't figure it out until I was out of residency in private practice doing thyroid surgeries, which is something that ear, nose, and throat surgeons do. So I was already there when I went to a conference and somebody put up slides. It was a kind of an integrative conference, and somebody put up slides about low thyroid symptoms, and it was like, well, I have 80% of those symptoms. Hello. And then they said, and you don't have to have an abnormal TSH to be helped by taking thyroid medicine. And I was like, what? Wait, that doesn't make, you know, I didn't care that he couldn't tell me why it worked, but I tried it and I was like, oh my gosh, I feel so much better. I have all this energy now. I can fall asleep when I want to. I can wake up when I want to. It was like a miracle for me. So once I was feeling better, then I was like, okay, now I want to know why this works. And so that's one thing. But then the other thing is, so many of my patients in the ENT world, not just the ones who were coming in with a knot or a nodule or a tumor in their thyroid needing it taken out, but sinus patients, allergy patients, patients with chronic ear disease, all of these people who are sick, a lot of times are sick because they have a thyroid problem that nobody has recognized. And when you get that fixed, then all of a sudden they're not sick anymore. It's crazy.
That's wild. Many of these patients, I'm guessing they've gone to so many doctors and haven't been told this information, and all of a sudden hearing it and seeing the lights turn on. I can imagine how powerful and impactful that is on their health and motivation and everything.
Yeah, yeah. Well, I mean, it could be like I was, where I was just like, oh, I'm just cold natured, you know? My hands and feet are freezing all the time to the point that they hurt. But you're just cold natured. Okay. And I just accepted that because I had no memory of ever not being like that.
Hmm.
So, I mean, and that's just a part of it. It's just like, okay, I'm just a low energy person, I guess, you know? Um, and if you've had it for that long, then yeah, nope. I mean, I didn't keep going to the doctor. I mean, the third time I got given an antidepressant prescription, I was like, okay, I'm done. I
Yeah.
guess, I guess
Yeah.
this is just who I am. People who develop this issue later in life, yeah, they've got, doctor after doctor. I was never like this. I gained 40 pounds, this, that. They're, those people are frustrated and angry
Hmm.
at medicine. And it's no wonder, because 20% of people with thyroid problems don't respond to the standard treatment that we have. And another, I don't know even how many, I don't know how many people have the same problem that I had, where you have all those symptoms and you don't get diagnosed. I mean, who
Yeah.
knows how many there are?
I can imagine countless. And so these people live in just frustration of, or maybe even think like there's something wrong with me that can't be fixed. Like, just, I can't even imagine the mentality around that. But, you know, I think if somebody's clicking on this episode, they're curious about the thyroid, but I'd love to explain, what is the thyroid and what is its role in our body and how is it essential to overall health?
Sure. So your thyroid gland is a little butterfly shaped gland. It sits here. I'm going to point it on my, if you're watching a video of this, it's right here at the bottom part of your neck on either side of your windpipe. And then it has a little bridge that goes across. So it looks like an H, like the Honda sign. And it's part of your endocrine system. And endocrine means that your body creates and secretes chemicals that stay in your bloodstream and go to other parts of your body and cause actions to happen. They cause energy, or they cause proteins to be made, or they cause your muscles to contract faster, or your heart to beat faster, or and those are just a few of the things that thyroid does, because it really does affect your entire body. So, thyroid hormone is that chemical that is released out of your thyroid gland and into your body. It goes to all your cells. And in a perfect world, it is converted into the active hormone, and it does what it's supposed to do. It makes you warm. It makes you have energy. It makes you grow your hair and your nails and your skin. It makes you grow your organs and helps your brain develop and helps you think, and just so many things. It just does so many things.
Fantastic. And is, because I know there's a lot of the abbreviations when it comes to the markers, is thyroid hormone just kind of known as TH?
Okay, so this is funny, because in scientific literature, when you look at a study about thyroid, a lot of times they do just use TH. But the truth of the matter is, thyroid hormone is a series of related molecules. So it starts off as something called T4, or tetraiodothyronine. That's a big mouthful of a name, but thyroxine or levothyroxine are other names for T4. And that's the pre-hormone. And that means it has to be activated in your body or in your cells before it can do what it's supposed to do. And the reason it's called T4 is because there are 4 atoms of iodine stuck to that molecule of thyroid hormone. And so when it's activated, one of those iodines gets knocked off, and then it's T3, or triiodothyronine, or liothyronine are the other names for it. So T3 is, some is made in your thyroid gland, about 20% of what your body needs every day. And about 80% of it is produced in your cells by a particular enzyme that you have to have in order to make that, and then goes to the nucleus of the cell and does what it's supposed to do. So
That's a
there are other metabolites. So you can have something called reverse T3. Reverse T3 is like T3, but the iodine is taken off of a different location on the molecule. So I like to explain it as if it's a key and it's the same key blank, but it's just made slightly different. So it won't turn, it'll go in the lock, but it won't turn the lock. So
mm,
reverse T3, some people say, oh, well, it's just an inactive metabolite. But in my world and in my patients, the higher your reverse T3, the worse your thyroid function is, no matter what your other blood numbers are. And so I really do sit in the camp of this is a blocker of thyroid function. So that's reverse T3. And then there are other metabolites that are downstream that are like your body's trying to inactivate the T3 or the reverse T3 and take it down to T2 or T1 and then back to tyrosine, which is a protein that we have. And then it either gets peed out or it gets recycled and made into something else in your body.
fantastic. I've never heard kind of it that it's I mean, I knew T4 and T3 and reverse T3. What about when it comes to TSH and the antibodies? Where does that play in this whole loop?
Okay, so TSH is not from your thyroid gland. TSH comes and it stands for thyroid stimulating hormone. It is one of the control molecules that's produced in your pituitary gland, which is part of your brain. And it goes to the thyroid and it tells your thyroid, hey, we need to make more. So the higher your TSH is, the more your thyroid gland is being stimulated to make more. And if your thyroid can't keep up, then the TSH will just go higher and higher and higher. The converse is also true. If your TSH is very, very low, then there's no signal going to your thyroid gland to make more. Um, and a lot of thyroid doctors just assume that if your TSH is low, that you automatically are making plenty of thyroid. But there are lots of cases where that is not the case. And so when doctors check your TSH and they say it's fine or it's a little bit low, and they don't go on and check the other thyroid hormones, the ones that we just talked about, then it is possible that they are missing something. You could even have a tumor in your pituitary gland that's blocking your ability to make TSH. You could have very, very high levels of stress hormone, which is cortisol, and that can be blocking your TSH because that's one of the ways your body regulates your thyroid is by pushing down on TSH when you have too much stress going on. And that's complex. And most people, most physicians who treat thyroid have no idea that that's the case.
And I can imagine kind of in another angle to look at it. Let's say you go in, you think it's a thyroid issue, or there's something off, and your TSH is normal. They don't
Yes,
test further. But to
they
your point,
don't.
is
But
the T4 could be off. The reverse, there could be elevated levels of reverse T3. There could be so many factors in the rest of that loop. And so that's where I'm like, I think it's so important to get a full test with all those different markers because your
yeah,
TSH could be normal, but it's still, you got to look at, I mean, I think that's the beauty of functional medicine. It's getting really to the root of what's going on. Where
yeah.
do antibodies play in kind of this whole story?
Okay. So antibodies are a product of your immune system. So they are not from your thyroid either. They are your immune system, for some odd reason, decides that your thyroid is foreign and enemy and it attacks. And it can do, there are lots of different antibodies and they can do different things. So there's one kind of antibody that's called a thyroid stimulating immunoglobulin, TSI, that causes your thyroid to make too much thyroid hormone. It bypasses the TSH, it mimics TSH, it binds to your thyroid gland, and it goes, let's make more, 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 more. And the next thing you know, you're hyperthyroid, and that's called Graves' disease. It's not the only thing that can cause hyperthyroidism. The second autoimmune disease that we see a lot is something called Hashimoto's disease. And the truth of the matter is that people with Graves' disease very, very frequently will also have the antibodies for Hashimoto's. So not only are they producing too much thyroid, but the Hashimoto's um, are a signal that there is damage happening in your thyroid gland as well. It's being attacked by cellular immune system and causing damage, which will eventually cause it to burn out. And that's what Hashimoto's disease is as well. It's a progressive attack on your thyroid gland that damages the cell, replaces the thyroid hormone producing tissue with scar tissue, and leaves lumps and nodules behind, and gradually lowers your ability to make enough thyroid hormone to get by.
Mm.
So that's what those antibodies are. And there are two antibodies that we generally look at that are markers for that Hashimoto's disease, and those are thyroid peroxidase antibody and thyroglobulin antibody. And if you have any of that in your body, that's an indication that you've got an autoimmune process going on.
So would you say it's normal, or what we're looking for is you don't want any of those
I
antibodies in
want
your body?
zero. I
Okay.
want zero on all of those. Yeah.
Okay, great to know. And kind of why we're at numbers, I'm curious if we're able to, because there's, conventional testing, there's functional testing, and I think especially when it comes to the thyroid and there's markers, the numbers that those doctors look for are significantly different. Would you be able to kind of walk us through those different markers and what is some optimal ranges we want to shoot for?
Sure, absolutely. And first thing I'll say is that none of the testing that I do is considered quote unquote functional testing.
Hmm.
All of the tests that I order are available from mainstream labs, and they're covered by your insurance. And so
Right.
if somebody's telling you, oh, you need to have all these tests and they're not going to be covered by your insurance, and I'm going to charge you, $499 or whatever, it's just like, that's not necessary. I mean, I think, I have in my practice, I have an agreement with the major labs where they can, if I have a patient who doesn't have insurance, and I can order the labs, I pay for the labs, and then the patient pays me directly. My complete lab panel for thyroid, it's like $55.
Mm.
It's not a high amount of money. And so people get this idea, oh, I have to go and get this special thing. And it's like, no, they're not that special. It's just that doctors don't know that they can order them, and they don't know the right codes to put in to get them covered. And so that's a little bit of a problem. But, any doctor that wants to learn this, I am happy to teach them. As a matter of fact, I have a course where I'll teach people, or they can just curbside me and I'll talk to them about it. But anyway, let's go through one at a time what those normals would be. So I always start with free T4,
Okay.
and there are differences. So the reference range for free T4 is 0.82 to 1.77 nanograms per deciliters, and that's from LabCorp, which is a mainstream lab. But when I test that, I want to see right at the bottom of the normal range. I don't want people to be up as high as 1.5, 1.6, 1.7. I really think they are either hyperthyroid or they're being overtreated with something to have that level. So my normal range actually goes from slightly below normal, so 0.7, up to about 1.3.
Okay.
And if a person is on treatment, I don't want it to go above 1.0, because too much T4, and we can talk about this in a minute, too much T4 can result in high levels of reverse T3, which is actually something you don't want. All right, next one, free T3. So the reference range for free T3 goes all the way from 2 to 4.4 picograms per mil. And I like people to be at the very minimum in the upper half to about the upper quarter of that range. I do not want people going above that 4.4, but I'm like, if you're 3.5 to 4.0, I'm pretty darn happy. That's where I
Right.
like to see people. So that's my ideal. Um, the next thing that I order is the total T3. And total T3 is a different animal because thyroid hormones exist in your body bound to proteins. It's like they don't circulate well and they get eliminated from your kidneys really, really fast if they're not bound to proteins. And so 99 to 99.9% of what's present in your body is bound to proteins. When we test free T3 and free T4, we're actually testing that tiny, tiny little fraction that's not bound to the proteins. So if I look at total T3, then I'm testing all of it. I'm testing what's bound and what's not bound. So it comes out, and my normal is about 100 to 155 nanograms per deciliter. And the reference range is 71 to 180 nanograms per deciliter. So, once again, my ideal is in the middle of that normal range.
So I have a question for you. If we are focused on T3 and T4, and those are kind of the active forms,
Mm-hmm.
why is it necessary for us to understand the ones that, because you're saying
That
the
are
ones that are,
total,
yes,
that a bound one. Well, the reason for that comes with the reverse T3, and let's talk about
great.
that next. So reverse T3 is not available as a lab test for free reverse T3. It's not available. Can't get it. And the reason why is because it would be way below the bottom limit of detection in the test. It's like zero point zero 0.00. You look at a lab and they'll have a lab test of less than 0.05. Well, that means they can't tell you how much there is below that 0.05. And so reverse T3 would always be, if you were trying for free reverse T3, would be a bunch lower than what they can detect. And it would always be less than zero point 0.0 whatever. And so we don't test free reverse T3. We test total reverse T3. And they don't say it's total, but it is. If you ask for that lab test, it's total reverse T3. And the reason we need the total T3 is so that we can compare it with consistency to the reverse T3. Because the proteins that you have that bind those two hormones go up and down. They go up and down with your menstrual cycle. They go up and down with your nutrition level. They go up and down if you're on birth control pills or if you have insulin resistance or diabetes. There's lots and lots of things that affect those protein levels. And so it's important to be able to compare apples to apples. And that's why I get the total T3. The next thing I do is that I do division. I say the total T3 divided by the reverse T3. And that gives me a ratio. And that number in the ideal world to me is between 10 and 14. And if
Okay.
you're a teenager, it might be 15 or 16, but it's not going to be below 10. And the reason for that is that T3 and reverse T3 are both made from T4. Remember, they come out of your thyroid gland at that 10 to 1 ratio. So 90% of what comes out of your thyroid gland is T4, 10% is T3 or 9% is T3, and then 1% is reverse T3. So that 10 to 1 ratio is how it shows up in your bloodstream before your body goes, oh, well, we need to make more T3 to have enough. And so if your ratio is less than 10, that indicates that T3 is not being activated. As a matter of fact, reverse T3 is being activated higher than T3. It's not in balance anymore. And the lower that number gets, the worse people feel. And so I look very carefully at that ratio. That's actually one of the most important things that I test.
Great. Super helpful.
Then our last test that's actually a thyroid test is the TSH, thyroid stimulating hormone. We talked about that a little bit ago, that it comes not from your thyroid but from your pituitary gland. And the reference range, as it's given, is 0.45 to 4.5 IUs per mil. And that's a 10x difference. I mean, from the lowest to the highest, that's 10 times different.
Yeah.
It's amazing to me that the reference range is the way it is. Um, and so I look at that and I say, I think my ideal range is from the 0.4 to about 1 if you're on treatment. It shouldn't go below 0.4. It shouldn't be above 1. If you're not on treatment, it can be as high as 2. And I'm not chuffed as long as you don't have symptoms and as long as the other numbers are correct. So that's those 5. And then the antibodies, like I said, I feel like 0 is the right number.
Okay.
Um, Now the thyroid peroxidase antibody can go up to, and I don't remember the units, but it can go from like 9 all the way to 1600 before they say it's out of the range that we can measure. And so I will sometimes pay attention because the higher that number is, the more active damage is being done in your thyroid gland and the more rapidly your thyroid function is going to change. And the more likelihood it is that you're going to have a lot of reverse T3 floating around, because that's one of the things that autoimmune thyroid disease does, is that it's like the system is in crisis mode. And so it's like, we got to slow this down. Part of the reason why that happens is because when damage is being done to your thyroid gland, it's releasing thyroid hormone from your gland, not in response to TSH, but just in random bursts as the damage happens. And so your T4 and your T3 can go up and down and up and down. And your body's like, oh my gosh, it's not really, but it's a chemical signal. Your body's like, we have to stop this. And that's what reverse T3 is for. It's for keeping your thyroid from being too high, because that's deadly.
Mm-hmm.
Low thyroid, if you have no thyroid hormone in your body, you're going to die. It's probably take about a year and you'll be really stupid for a long time before it happens. If your thyroid goes too high and you don't do something about it, it can kill you in a day. Um, I mean, it probably won't, but people end up in the emergency room, in the ICU, in a coma very, very quickly if they have too much thyroid hormone. And that's what this is. It's a fail-safe mechanism to stop that process from happening as best as your body can do it. The other thing it's for is to keep you from starving to death and burning up all your energy resources in the event of a famine or a severe illness or a severe injury where you're running high fever and you're super, super sick. Your body would just burn up all your calories and leave you basically defenseless. And so that's another thing that reverse T3 does, is it puts you into hibernation mode so that you don't burn up all your resources.
I think our bodies are incredibly brilliant in the way that they're designed to have all these mechanisms integrated and to be able to be there for emergencies. I think it's fantastic. Thank you so much for going over those numbers. I know that's going to be incredibly beneficial for those, maybe even with some lab work in front of them to kind of run through those. As far as symptoms go, so I think a lot of us know the common symptoms. Somebody who tends to have more hyperthyroidism, they can possibly be thinner, very high energy, and kind of the opposite when it comes to hypo. Are there some other common signs and symptoms that maybe people often overlook?
So if you are hyperthyroid, then a fast heartbeat is going to be something that you might notice. You might notice anxiety. You might notice palpitations. You might notice, oh wow, I'm losing weight and I'm not even trying, and I eat whatever I want and I'm still losing. And for a lot of people, if they were hypothyroid before and didn't know it, that feels pretty good for a while. And so I
Mm.
have a lot of patients who come in with hyperthyroidism who are like, I don't want to take medicine. I don't want to slow this down. I feel good. I'm losing weight. And it's really dangerous because it can end up in heart failure.
How often is that transition happen where somebody goes from hypo to hyper?
In in Hashimoto's disease, it can happen like a roller coaster, up, down, up, down.
But I mean, I guess in terms of, okay, so that's interesting. So just one individual, it can go back and forth.
Mm-hmm.
Now, but what about, like, let's say you're known, your whole life or however many years I'm hypo, for that individual to then move over and transition into hyper and start experiencing that.
Maybe not that common. Here's the thing. We just briefly said something about insulin resistance a little while ago. And what my experience has been is that insulin resistance and low thyroid go together. And so you don't have to have really low thyroid to have insulin resistance, but they live on the same um, genetic material in your body, and so they get inherited together. And if you have insulin resistance, it's very, very likely that you have weight problems. And so if you're all of a sudden like, wow, look, I'm losing weight and I'm not trying nearly as hard as I was before and I feel good. I wouldn't say it's really common. Graves' disease is pretty uncommon. Um, but not as uncommon as I thought it was. I mean, I see, I guess people find me, so I'm biased on how many there are, um, but it's not as uncommon as I thought. Now, hypothyroidism. So Hashimoto's disease, to quote a statistic, 50% of American adults show signs of those antibodies. 15%. That's what, 60 million, 90 million people
Mm.
in the US? It's a lot. No, that's not true. I'm overstating that. Probably 60 million. So 15% of Americans have those antibodies. If you have those antibodies, your likelihood of developing hypothyroidism is about 3% every year after you get those antibodies positive. So it's still pretty darn common.
Yeah. I didn't realize that. Hmm. Okay, now, so we can kind of, a lot of individuals can go back and forth. It's much more common than we think. What about in regards to stress? Because I think majority of
Mm,
us face stress on an everyday basis. Why is cortisol such an important factor to consider in
mhm.
regards to thyroid function?
There's a couple reasons. The first one is that cortisol is controlled also by your pituitary gland. So we said TSH comes from your pituitary gland. Cortisol is the hormone your body uses to handle stress. It's released in response from stress along with adrenaline. So, if somebody nearly hits you in the intersection, your adrenaline goes, within half a second. Your cortisol takes about 30 seconds and then it goes up and it stays up. Your adrenaline, it's gone in 5 minutes, but the cortisol stays high. Your heart rate stays high. Your body's ready to fight or run, and it raises your blood sugar. Um, if you stay in that fight or flight all the time, then your body is basically preparing for an emergency all the time. And one of the ways it does that is by raising your blood sugar with insulin resistance. The other way it does it is by turning on the other conservation mechanisms that you have. And one of those is by turning down your thyroid, which lowers your metabolism, which means you're not going to starve to death as quick. So high cortisol feeds back on your pituitary gland and lowers the amount of TSH that you have. So that's one thing that very few people realize. Um, the other thing that it does is high cortisol turns down the enzymes that make the T3 and turns up the enzymes that make the reverse T3. And
Mm,
once again, it's conservation mechanism. It's we have to save energy. We have to slow you down so that you can hibernate, so that you can make it through the winter because there's not enough food for everybody to go around. So people who have this ability to slow their thyroid down will survive, whereas the other ones won't,
yeah.
which I know that's kind of crazy.
Well, and I know cortisol and adrenals. I mean, I'd love to kind of pull into that and how that's all connected and linked.
Yeah.
Because I know a lot of us, what is it? Oh my gosh, I'm blanking on the pregnancy brain. My brain is fried with so many things, but your adrenals and your thyroid are so commonly linked. And so when I talk to individuals who maybe struggle with thyroid issues, I start bringing up the conversation in adrenals and vice versa. What's the connection between the two of those, and what should listeners know about that connection?
Well, here's the interesting thing about cortisol is that your your body only has one mechanism for handling stress, and that's cortisol. You know, it doesn't have a different hormone for, wow, I didn't study enough for this test and I think I might flunk it, versus, holy cow, there's a guy with a knife in the alley and
Mm,
he's after me and he's going to kill me. Your body has no differentiation between those two things. Fight with your husband, same thing. Kid falls down and hurts himself, you got to take him to the ER, same thing. Your body reacts in the exact same way to all of those. Can't pay the bills, blah blah blah, they're all managed in the same way, even though our situation, our actual risk for we're going to die is way way different. you know it's way you didn't get invited to the party you wanted to. It's another, it's just like, it's what your brain tells you is going on. It's fear, anger, um, disgust, sadness, and then there's one other one. Oh
anxiousness,
darn
maybe,
it!
or I guess that's
It's not.
fear.
I'm sorry. Huh? Here I've got them written down. Shame.
Mm,
It's like, okay, I'm ashamed. I didn't get invited to this party. I'm not, I'm angry and ashamed. I'm going to get kicked out of the tribe. If you get kicked out of the tribe, you die. So your body reacts to those emotions in the same way, no matter what the circumstance was that triggered it.
yeah.
And that's really, when I think about that, it's just like, that's just so insane.
Well, it's an interesting way of looking at it, because I've heard it in a way of, okay, we don't have the lions and tigers chasing us as we did when we were cavemen, and now it's these smaller things. But I don't know, something about the way you phrased it really opened my eyes of, like, your body doesn't differentiate between these two different things. I'm curious though if some circumstances signal more cortisol than others, or you're saying that that's all equal all around.
You know, it's it's varies from person to person, and it varies from how you handle your stress. I
True,
mean,
your
if you
resilience.
are, what, I believe in karma. That person's going to pay for not inviting me to this party. I am totally cool with it. That's going to be a totally different amount of cortisol than, oh my gosh, I was really wanting that invitation. I think I'm going to die of shame. Oh, 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 oh. Totally different response.
Yeah, that makes sense.
And so it's how you handle the circumstances that makes the biggest difference.
Yep. That's why I think resiliency is so important to
Yeah.
learn and to grow and strengthen. Kind of, I'd love
And
to
it is a skill. I'm
very
sorry.
much so.
Didn't
And it's
mean
a
to interrupt you.
lifelong skill. It's an
It's a
everyday
skill
practice.
that you can develop.
Yes. Yep. When it comes to maybe nutrition and supplementation,
Mhm.
what are some things that we can make sure that we're including in our diet for overall thyroid function? Maybe there's something that's more geared towards more Hashimoto's or Graves.
Mhm.
What are some of these foods or supplements that you would recommend?
Sure. So Most of the particular nutrients that your thyroid needs are pretty simple. It needs protein. Tyrosine is the particular protein type and amino acid type that it needs. It also needs iron, it needs iodine, it needs zinc, and it needs selenium. The enzymes that make the thyroid hormone are selenoproteins. They are enzymes that require selenium. So those minerals are super important. And then there is, before I go on to something else, it's really important to say that iodine deficiency is pretty rampant in the US. It's rampant because we don't eat enough seaweed and fish. It's rampant because there are certain areas of the country where the soil doesn't have iodine in it. And so our vegetables don't have iodine in it. And it was amazing to me back in the 1930s, so almost 100 years ago, the government in its wisdom decided to put iodine into salt. And in the counties where iodine deficiency in the soil was the worst, the IQ of the average person went up 10 points. And that's because of thyroid. And so if you don't think it's affecting your brain, you're wrong,
It
because
went
it
up 10
is.
points because these individuals had now that iodized salt.
Correct. So they were no longer as iodine deficient as they had been. However, people are like, oh, well, then I should go out and get an iodine supplement. Well, you got to be really careful with that, because high levels of iodine, and most of the iodine, like if you buy nascent iodine or Lugol's iodine or whatever from a supplement store, you can get way too much iodine. And too much iodine is dangerous, and it can cause you to grow nodules, and it can cause you to have triggered Hashimoto's disease, even if you didn't have it before. And so I really want people to be careful and realize that you don't want to go over a milligram of iodine per day. Absolutely don't want to go over 1 milligram. And that's 1,000 micrograms is one
Okay.
milligram. Selenium is the same way. It's a double-edged sword. If you don't have enough, you make those selenoproteins. You can't produce the thyroid hormones. You can't change from T4 to T3 because you don't have the right thing. But too much selenium causes birth defects and miscarriages and is dangerous. And so selenium, it's like, I wouldn't say more than 200 micrograms in a day, and that's 0.2 of a milligram. That's a very tiny amount. So those are super, super important to realize, is that there is definitely too much. Too much is just as bad as not enough in some things.
Yeah, that's great. I think I read years ago that one Brazil nut or maybe two Brazil nuts have enough selenium for a daily amount.
And it depends a lot on where that Brazil nut was grown. And
True.
so I generally, when I'm asking people to add selenium to their diet, I'm generally going for a supplement and not for a Brazil nut, because what I've heard is that if you eat 5 Brazil nuts, it's possible to be toxic.
Hmm.
And I'm like, dang,
Wow.
that's
That seems
crazy.
too easy.
I know.
Huh.
And so where that Brazil nut was grown can vary. The selenium
Yeah.
content can vary a huge amount.
Yeah. Whereas the supplements is a little bit more regulated. You know exactly what you're putting in your body.
You
Yeah, that makes
you
sense.
hope you do if it's a reputable
True.
company.
Very much so. That's why third party testing and consistent testing is so
Yes,
important.
third party testing, all for it.
Absolutely. So, one more thing I'd love to kind of end with is, well, almost end with, is what about for those individuals who are on thyroid medication? Do you have any tips for them of ways that they can improve their health and thyroid health?
Sure. Well, so here's the deal. About 80% of people who go on levothyroxine do pretty well. And not only does it normalize their TSH, but it also helps their symptoms. But probably 20%, maybe even more than 20% of people, their TSH will be normal and they still won't feel good. They still can't lose weight. Their hair is still falling out, all the things. Um, and there are some tips that I give to people who come into me with that scenario. And the first one is to break it in half and take it twice a day. And that sounds really like a pain in the ass, but let me tell you why that is. So, one of the reasons that people make a lot of reverse T3 is because if you take your T4, which is levothyroxine, if you take it once a day, for first couple of hours after you take it, you have a very, very high blood level. And then it'll start to go down slowly and gradually. And then right before you take your next pill is when you go to the lab. And so you get that lab test at the very bottom of what your average daily amount that's in your bloodstream is. Well, your body sees that spike of high T4 and says, oh my gosh, too much. And it makes a bunch of reverse T3. And once your body is activated towards making reverse T3 and that enzyme is made, it sticks around for a long time. And so if you break your pill in half, then you get half as high of a spike, and your average is closer to a steady state than it would be if you only take it once a day. You can actually make it even better, take it 3 times a day, but that's a little bit overkill. The second thing that I tell people is the pharmacist is being super, super cautious. The pharmacist is telling you you have to wait 2 hours before you eat, 2 hours after you eat, because he wants to make absolutely sure that you absorb every speck of your thyroid hormone. And what happens is people don't remember. They get up in the morning and they're like, oh, I went straight for the coffee and I put a bunch of heavy cream in my coffee. Now I have to wait 2 hours to take my thyroid medicine. And guess what happens? They forget. Dinner time, same thing. Oh, well, it's only been an hour since dinner, so I have to wait to take my thyroid medicine. And the next thing you know, you forgot. And so I tell people when you're taking thyroid hormone, 30 minutes is plenty long to wait. So get up in the morning, put the pill in your mouth, swallow it, then go to the shower, take your shower, then go to the coffee pot, turn on the coffee pot. Um, I mean, modern stress relief science is saying wait an hour before you wake
I
after
was
you wake up to take your caffeine anyway.
I was just
And
going to say
so
that.
um so really wait an hour before you eat breakfast. But it doesn't need to be 2 hours. That's too much.
I like that. It's like
And
it doesn't have to be all or nothing. Let's find an
right,
in between where you are consistently taking it and it's a
right.
realistic,
Yeah, no, the
implementation.
consistency is way more important than the avoiding of food. That's and the other thing, the opposite is also true. If you got up and you went and ate breakfast and you're like, "Oh my gosh, I forgot to take my thyroid hormone." Just take it. Just take it. Because truly the only food that's going to block the absorption of your thyroid medicine really is soy. Soy is the only food that's really a problem. And then maybe high levels of a calcium supplement. But I tell people, look, take your calcium supplement at lunch if you're going to take one.
Yeah.
So when you remember, put the pill in your mouth if you forgot. That's kind of the thing. And the other thing I do is, I really, really encourage people to put alarms in their phones.
Mhm.
Make sure you have a reminder. Make sure you have a reminder. When you're taking it twice a day, you got to have 2 reminders, not just one. The second thing that's really, really important for people who are on thyroid medicine to realize is, once again, it's about those levels throughout the day. Is when you first took the medicine, your level goes way, way up and it stays up for a couple hours and then it gradually comes down. And if you are seeing your doctor at 2 in the afternoon and you get your labs drawn at 2 in the afternoon, your lab test is going to be way, way different than if you skipped your thyroid pill in the morning and went to the lab at 9. And so, what I tell people to do is, after you're taking your thyroid medicine twice a day, go to the lab 6 hours after that morning dose at the same time every time. That way, you get a consistent lab test, because what happens to that person who went at 9 today and 2 the next day and in a different time the time after that is that their doctors looking at those numbers and going, oh, it's too high, we have to lower your dose. Oh, it's too low, we have to raise your dose. Up and down and up and down. It puts you on a roller coaster and you feel terrible all the time.
You would think doctors would, I mean, is that a normal practice where they say, I want you to get your lab work done at a consistent time?
There, so many thyroid patients are managed by primary care doctors, and they have the lab right there in their office. It's very convenient. They're like, oh, okay, go get your TSH, and it's 2:30 in the afternoon. The
Mm-hmm.
next time it's a different time, and the next time it's a different time. Now, if you go to an outside lab and you go to an endocrinologist or you go to somebody who's really savvy about this stuff, they may tell you, oh no, always skip your thyroid medicine and then take your lab first thing in the morning. And like I said, what that gives you is the lowest point. It doesn't give you what your highest point was. I don't want the lowest. I don't want the highest. I want to know what it was in between. So that's two reasons to split your dose and another reason. So what that gives you is consistency.
Yep.
And
Brilliant.
the amount of thyroid that's in your body can vary 30% or more. And you would think, based on those reference ranges for labs, where 0.82 is normal and 1.77 is also normal, that it's okay for it to vary by twice as much. But it's not. It's not. You'll feel crappy if your levels go up and down like that.
Yeah, great. Those are excellent tips. For those wanting to know more about their thyroid health or any of the work that that you do, where can people find you?
Sure. So my clinic is in North Texas. I also have a medical license in Iowa. I know that's weird, but that's what I have. And you can go on my website, which is my name, danagibbsmd.com. And there are all kinds of videos on there. I also have a YouTube channel, I have an Instagram. And if you think this is you, that you have thyroid problems that have not been diagnosed and not been found, or that you're just doing terrible on the treatment and you've tried everything, I do free discovery calls. So just sign up for a discovery call and talk to me. Tell me what's going on and I'll see if I can help you out.
Fantastic. This was so valuable. I appreciate your time and energy going into the depths of all the different markers and the tips. I mean, I feel like this is going to be an incredible resource for those in any stage or spectrum of the thyroid health, whether they're curious if they have something going on, they already know that they do, and they're on medication. I think this was a really invaluable resource. So I appreciate your time today and all your experience and expertise on the topic.
Thank you so much for having me. This has been great.
Absolutely. All right. Take care, Dana.
Bye.
Bye.